V1 Q wave negative T, V2 Q wave negative T, V3 negative T, V4 negative T, V5 negative T. Subacute transmural because R wave is absent. Myocardial infarction of V1, V2 anterior wall, V3 septum, V4 apex, V5, V6 lateral wall. In this case, V1, V2, V3, V4 and V5 part of lateral wall. You can see depression of ST segment and negative T in V1, V2. If patient feel acute pain, it is acute acute coronary syndrome. If patient don't feel pain and patient had these changes before, it can be stenocardia. To differentiate, we need take troponin test and patient complaints and anamnesis data. Signs of ischemia. M like R wave in V1, V2, Y des wave in V6. It is right branch bundle of His block. M like shape of R wave in V1, V2. Main sign. This card includes a lot of changes. First change, very high P wave. P wave higher than R wave. It is hypertrophy of the right atrium. Wide P wave and doubling of P wave. It is hypertrophy of the left atrium. Next one, QS wave. QS wave, elevation of ST, big T. QS, elevation of ST, big T. Elevation of ST, big T, QS wave. Acute transmural myocardial infarction of anterior wall, septum, apex, and lateral wall. QS, elevation of ST. Elevation of ST, biphasic T. Q wave, no, it's not a Q, it's S wave, elevation of ST, biphasic T. Elevation of ST, elevation of ST, elevation of ST. Because of Q wave is present in V1, it is acute transmural myocardial infarction of anterior wall, septum, apex, and lateral wall. Additionally, patient has change Q wave in second, third, and AVF. It is post-infarction cardiosclerosis. Patient had myocardial infarction in inferior wall of the heart some time ago, maybe some years ago, some months ago, and new acute myocardial infarction in left ventricle. QS, elevation of ST. QS, elevation of ST. Acute transmural myocardial infarction of inferior wall. Because second, third, and AVF, same changes. M-like shape of QRS complex in V1, V2, deep and wide S wave in V6. Right branch bundle of His block, because these changes in V1, V2, main changes M-like shape. Irregular rhythm, P wave is absent. Atrial fibrillation. M-like shape in V1, V2, widest wave in V5, V6, right branch bundle of His block. But there are signs of hypertrophy of the left ventricle because our wave very high. To know exactly, we need to count special indexes. M-like shape in V1, V2, right branch bundle of His block. M-like shape in V6, V5, left branch bundle of His block. Similar, M-like shape in V5, V6, left branch bundle of His block. Normal, normal, something abnormal. This complex is different with this one, that's why it is extrasystole and ventricular extrasystole, because complex is different with this one. Normal, normal, abnormal, ventricular extrasystole. You can see irregular rhythm, very short distance here, long distance here. That's why it is extrasystole, because there are short distance here and long distance here. It is supraventricular extrasystole because this complex is similar with normal complex. That's why it is supraventricular extrasystole. Normal, normal, abnormal. Normal, normal, abnormal. Normal, normal, abnormal. Ventricular extrasystole, every third instruction. It is trigemia. Trigemia of supraventricular extrasystole. Irregular rhythm, distances are different, and absence of P wave, atrial fibrillation. This one place. Something disappear, very long distance in these places, yeah? This complex can be due to extrasystole. Long distance after some complexes can be due to extrasystole or some blocks. To understand what changes, you need to compare this distance. This distance and this one are similar. That's why it is not extrasystole, because in extrasystole, this distance shorter than normal. That's why it is some one of the blocks. We can see that PQRS complex disappear in this place. We can put one complex between these two complexes and we will receive normal heart rhythm. PQRS complex disappear. If PQRS complex disappear, it is sinoatrial block. If it is some stages of AV block, P still in normal place, QRS complex disappear. In this case, it is sinoatrial block. This card includes all types of the blocks. When you will on exam, if you will have question about blocks, you need to try to find this card, because it is included everything. Number A, sinoatrial block. Normal complex and complex disappear. P, Q, R, S waves are absent. That's why it is sinoatrial block. Next one, doubling of P wave. It can be due to atrial hypertrophy, left atrial hypertrophy, or it can be due to intra-atrial block of connection inside of the atrium. Next one, elongation of PQ distance. Only elongation of PQ distance, nothing more. It is AV block first stage. Next one. PQ distance close to normal, longer, and QRS complex disappear. P wave still on ECG. AV block, second stage, Mobitz 1. AV block, second stage, Mobitz 1. Because PQ distance longer, and QRS complex disappear. Next one. PQ distance long and similar every time, and QRS complex disappear. It is AV block, second stage, Mobitz 2. In differences with this one, distance long every time, distance longer and longer every time. This one distance. And last one, full AV block. P wave has own rhythm, about 60 to 90. QRS complex has own rhythm, about 40 to 60. And P wave can appear before QRS complex, after QRS complex, and together with QRS complex, because they has own rhythms. Types of extrasystoles. It is ventricular extrasystole because complex wide and deformed, and every second construction we can see extrasystolic complex. It is bigeminium. Every third construction is extrasystole. Trigeminium. Every fourth construction, tetrageminium. You can see normal ECG, then rhythm changed. It is paroxysm of ventricular tachycardia. In this case, ventricular tachycardia because QRS complex deformed. You can see paroxysm of atrial fibrillation. If you see normal ECG, then P wave disappeared and rhythm start being irregular. It is paroxysm of atrial fibrillation. If you will see normal ECG, then sinus tachycardia. It is paroxysm of sinus tachycardia. Paroxysm means you can see exacerbation. You can see changes in ECG from normal to something. And this one. Normal complex, abnormal. Normal, abnormal. Normal, abnormal. Every second construction is extrasystole. That's why it is bigeminium. But complexes are different every time. It is polytopic extrasystole. Extrasystoles from different places in the heart. Very short distances, it is tachycardia. Complex sync, that's why it is supraventricular tachycardia. This one card. Long distance, short distance. It can be due to two reasons. First reason, extrasystole. Every second construction is extrasystole. Or it can be due to block. P wave is absent before this complex. That's why maybe it is due to extrasystole. But it's too difficult to differentiate when patient has bigemia. It can be block of conduction every second construction. It can be sinoatrial block because we can put else1 complex between this one. But it's closer to supraventricular extrasystole. This one, sinoatrial block exactly. Short distance and very long distance. PQRS complex disappeared. And normal rhythm again. QS negative T, QS negative T, QS negative T, similar negative T. Subacute, because ST segment close to either electric line. Transmural, because R wave is absent. Myocardial infarction of anterior wall, septum, apex, and part of lateral wall. You can see tachycardia, where the distances between complexes, and complex QRS complex is seen. That's why it is supraventricular tachycardia. Last one. QS, elevation of ST, negative T. Q wave, negative T. ST segment close to either electric line. In this case too, ST segment close to either electric line. Q wave is present. It is subacute stage of transmural myocardial infarction of V1, V2. Anterior wall and septum. That's all about ECG.